Hi, my name is Shannon and this is Heath, and we are physical therapists here at WVU Medicine's J.W. Ruby Memorial Hospital. We are going to demonstrate some exercises for you to begin leading up to your total joint replacement. If any of the exercises cause an increase in pain, please avoid that exercise. If you have any questions, please contact your physician or the nurse clinician at the Center for Joint Replacement at WVU Medicine. For this exercise, you're going to pull your toes up as far as you can comfortably and then point them down as far as you can comfortably. You'll perform this exercise 10 to 20 times and complete this 1 to 2 times a day. For this exercise, you're going to tighten the muscles up on your thigh and hold it for a nice slow 5 count, and then you'll relax. You'll complete this exercise 10 to 20 times and perform these 1 to 2 times a day. This exercise is for your buttock. You're going to squeeze your cheeks together, hold for a slow 3 count, and relax. You'll complete this exercise 10 to 20 times and perform once or twice a day. For this exercise, you're going to bend your non-operative leg up onto the bed, and you're going to raise your operative leg or pre-operative leg straight up off the bed. Pause at the top and then lower back down. You don't have to raise your leg any higher than your bent knee. You'll perform this exercise 10 to 20 times, 1 to 2 times a day. For this exercise, you're going to bend your operative or preoperative knee up onto the bed and then lower it back down. You want to try to maintain contact with the bed with your heel, and you'll perform this exercise 10 to 20 times, 1 to 2 times per day. This exercise is to strengthen your arms to assist with walking with a walker. You'll need a straight chair with sturdy armrests. You'll sit in the chair and then you'll raise your bottom up off of the chair with your arms and lower back down. You can use your legs to assist as needed. You'll complete this exercise 10 to 20 times and perform 1 to 2 times per day.